Hey there, everybody. Q&A, Ask the Structural Chiropractor. We are on question 3. Why do chiropractors claim to help problems other than back pain? Isn't this just quackery? Well, who am I? I am Dr. Zachary Ward. I'm a chiropractor in Auburn Hills, Michigan. My practice is online at laichiro.com. You can reach me there. I practice structural and upper cervical chiropractic procedures. There's a couple different ways that we can answer this tough question. I'm going to go about it 2 different ways. The first way is just simply to say, sometimes when we hear a story about a practitioner saying things that seem kind of quackish, there is a possibility that something has been lost in translation. So the word symptom, the word diagnosis, condition, treatment, cure, primary symptom, sequelae, these are all terms that have specific definitions within healthcare, but even different kinds of practitioners can use them slightly differently from each other. And then when you're dealing with the general public who may not have an education in what all these terms really mean, it can get kind of confusing. It can be kind of like a game of telephone where somebody says something to one person, that person translates it for somebody else, and then by the time it reaches the final destination, it has a slight different ring to it than what was said originally. For example, I work with a lot of patients with vertigo. I also work with a lot of patients with trigeminal neuralgia or facial pain. Let's say I adjust them or we have a specific correction to the upper cervical spine and they stop having facial pain and that pain actually goes into remission for a while. Did I cure their trigeminal neuralgia? A patient who experiences this may say something to somebody else and that person may then translate that for somebody else that says, hey, my friend Bob went to this person for their facial pain, and guess what? This guy cured his trigeminal neuralgia. Now, I as a chiropractor may never actually say those words. We could talk about improving the symptoms, having them go into remission for an extended period of time. More likely than not, you're not going to hear somebody say cure trigeminal neuralgia. However, a layperson may communicate it that way, and it may make the doctor sound quackish to somebody outside that conversation. Here's another way to answer this question. So let me, if you'll allow me, tell you about a revolutionary health solution that can do all these things on the screen in front of you. So this revolutionary health solution can decrease your diabetes risk, it can decrease your high blood pressure, it can improve your readings of unhealthy cholesterol, it can reduce heart disease risk, reduce cancer risk, reduce stroke. You'll experience better joint mobility with less joint pain. You'll have reduced back pain. You'll have less osteoarthritic breakdown pretty much everywhere. It'll decrease your sleep apnea, improve your sleep quality, improve your mood, normalize your hormone levels and your energy levels and your sex life, etc., etc., etc. So what is this revolutionary health solution? Well, it's in fact losing weight. It's almost like a magic pill. Well, let me give you another thought experiment. Let me tell you about a revolutionary health solution that can reduce ear infections in kids, decrease neck, shoulder, knee, and low back pain pretty regularly, help with migraine symptoms, allow breech babies to turn head down properly in the womb, normalize digestion in cases of irritable bowel, sometimes other inflammatory bowel conditions, improve mood and concentration, improve sport performance, decrease problematic sway and balance problems in the elderly, reduce numbness and weakness in the extremities, reduce brain fog and chronic pain after concussion, ease behaviors associated with sensory processing disorder, and symptoms associated with neurodegenerative diseases like MS and Parkinson's, right? That sounds pretty revolutionary as well. What's that? What's this magic pill, you say? Well, it is actually, in fact, bringing the brain, the spine, spinal cord into better balance with each other through the use of chiropractic procedures. I outlined several of these kinds of cases in a series that I have called 10 Patients in 10 Minutes, which you can go ahead and look up also on my YouTube channel and my Facebook page. So on one hand, we have something that we might call metabolic hygiene, right? So we address the issues, the fundamental breakdown in the metabolism and other aspects of our health that are interrelated with that by addressing the weight issue. On the other side, we have spinal hygiene, where we address the fundamental breakdown and what keeps us upright and open in the spine and the other extremities, and how that interplays with all of our systems. But in our culture, we can talk about metabolic hygiene, we can talk about good doctors telling their patients that they need to lose weight, but we don't talk about spinal hygiene. There aren't good doctors who tell their patients, hey, you need to be in alignment because it's going to affect all of these body-wide systems. In the chiropractic notion of health, in general, the body works better when it's under less spinal stress, just like the body works better when it's under less metabolic stress. So those are two examples of systems level thinking, metabolic hygiene and posture, spinal hygiene. So that is two ways to answer that question. Why do chiropractors say they can help things other than low back or neck pain? The question remains though, what about truly quackish behavior? What do we do about this? Well, the first question is, for me, when I'm hearing about these stories, is what did the doctor really say? Can I say for sure that I know that the person who's coming to me, who told me that so-and-so said such and such, that we're all using the same terms together? If I don't know that I can verify that, then I'm not necessarily going to label what somebody said as quackish behavior. 2, is this well-intended and based on sincere belief? So healthcare is huge. There's a ton of people who are healthcare providers, and not all of them have the same life experience. For example, there may be somebody in my area that truly believes that helping cancer treatment or cancer survivors heal through the use of aromatherapy is something that is good to do. And that person may have a sincere and well-intended belief in that practice, and they may recommend that practice. Now, somebody else may view that as completely quackish. If that person is well-intentioned and it's a sincere belief, even if it ends up being that they're sincerely wrong, this is different than the kind of quackish behavior where we're just after somebody's money or manipulating them. Okay, and so we have to kind of ask, is this really somebody who's malintentioned, or is this somebody who actually has a fundamental belief that what they're recommending is helpful? We can kind of interpret their behavior a little bit differently. Third question is it actually harmful? For example, if someone recommends to you that in addition to these 3 or 4 other things that you're doing, maybe consider doing option number 5. And they're not telling you don't do options 1 through 4. They're just saying, hey, maybe you should think about option 5. You may find that quackish, but the question is what they're recommending really harmful if it's not getting in the way of option 1, 2, 3, or 4, right? So this is always something that we have to consider. If we hear a story about so-and-so said such and such about how they could help X, Y, Z, we can kind of run it through this filter. Is that what the doctor really said? Are we all using the same terms? Is this well-intentioned or perhaps malintentioned? Can I know that? And 3, is it actually harmful? Is it harmful? Now, you may say yes to all 3 of those things, in which case maybe it truly is quackish behavior. But this is a great way of interpreting or trying to figure out what is actually being said when someone says, hey, so-and-so said something that was quackish. This is Dr. Zachary Ward here at Life and Alignment Chiropractic in Auburn Hills, Michigan. This is Ask the Structural Chiropractor. If you have any questions about this presentation or any other videos I have, go ahead and look me up on la@chiro.com or find me on social media.